Good morning. If everyone can get ready. Thank you. I'm Muriel Bowser. I'm the mayor of Washington, D.C., and we are here today in the Walter E. Washington Convention Center. I will provide an update on the district's response to COVID-19. I am going to provide some general updates, share more information about our medical surge planning, and we will also hear from our partners who have been involved in building this incredible facility. I am joined by members of my cabinet. To my right, Chris Rodriguez, who is the Director of D.C. Homeland Security, Dr. LaQuandra Nesbitt, who is the district's doctor and our Director of the Department of Health, Christopher Geldhart, who is leading the operations section of our Emergency Operations Center, and Jennifer Smith, who is the Director of the district's Department of Forensic Sciences. I'm also very delighted to be joined by our federal partners who have worked hand in hand with us, certainly for the last 22 days of construction, and longer than that in planning for the district's medical surge. We will hear from Pete Gaynor, who is the administrator for FEMA, the Federal Emergency Management Agency, as well as Lieutenant General Todd Simonite, who is the chief of the Army Corps of Engineers. He's the Chief of Engineers and Commanding General, as well as Dr. Jack Sava, who is the chair of MedStar Washington Hospital Center, Brigadier General Aaron Dean, who is the Adjutant General of the D.C. National Guard, as well as Greg Odell, who is the President and CEO of Events D.C. Let me start by first reporting that we have 117 new cases of COVID-19 reported yesterday, bringing our total to 6,389. And sadly, we announced that 5 Washingtonians have succumbed to the virus, bringing the total of lives lost in Washington, D.C. to 328. Here you also see the number of new cases reported over the last week, as well as the average of new cases per day over the last 2 weeks. I have also want to provide a brief update on where the district is with antibody testing. Until now, most of the testing that has been happening has been diagnostic to determine whether a person has COVID-19. Now, DC Health and the Department of Forensic Sciences are working with healthcare providers in the district to conduct a citywide survey to test for antibodies. While healthcare providers are receiving guidance on who should be considered eligible for antibody testing, the survey will focus on individuals with a high risk of exposure. The experts still don't know whether previous infection causes any sort of immunity, but this testing will be important to helping us determine the extent of infection in our city, the prevalence of asymptomatic infections, and insights on how the virus is affecting children. Now I want to move on to the part of today's update that addresses why we are here in the Washington Convention Center. In early April, we shared with you how we were planning for a medical surge, and that was only a month ago, and a lot has happened since then. We are pleased in the district that our numbers, the numbers of positive COVID cases in the district, are far lower than what we predicted they could have been on this day. But we have yet to see a 14-day decline in community transmission. And so we continue to have a lot of work to do to stop the spread of the virus in our city. In terms of planning for a medical surge, we also know that without a cure and without a vaccine, that phased openings will mean that we see more cases in our city and our region. So part of our surge planning takes that into account and readies us for a potential second phase. Here you can see a chart and that going forward we will provide regularly. It will be posted on a daily basis at coronavirus.dc.gov. This chart shows how many patients are in our hospitals, how many patients are hospitalized for COVID-19, and how close our hospitals are to reaching their capacity, both their normal capacity and using surge beds. You can see that yesterday, 1,775 patients were hospitalized in DC, which represents 71% of the district's standard operating capacity at our acute care facilities. Normally, without a pandemic, our acute care hospitals operate around 75% of capacity. The average utilization since April 1 has been under 70%, indicating that there is sufficient bed capacity within our facilities. So again, DC residents should not hesitate to seek medical care for COVID and for non-COVID related concerns. To support any potential medical surge, we have, of course, been working with hospitals across the city to identify capacity for an additional 1,600 beds within our hospitals. This chart shows where those surge beds are located. I want to, of course, thank all of our hospital partners for working hand in hand with us to make sure that the most acute patients are seen within the four walls of our hospitals that are waiting to give them excellent care. We are grateful to all of them, and you can see them listed here at MedStar Georgetown, MedStar Washington, who we'll hear from today, MedStar National Rehab, the George Washington University Hospital, Howard University Hospital, Children's National, Sibley Memorial, United Medical Center, and Bridgepoint at Capitol Hill and National Harbor. And just as you can see that we will report to you, we are monitoring our hospital capacity very carefully, which will let us know if and when we need to use the excess capacity that you will see here today. I've said before that we consider this site our insurance policy. We hope that we will never have to use it, but it is here and staffed for when we do, or if we do. This Hall A, is set up to accommodate 437 beds, and starting tomorrow, it would be ready in terms of equipment and staff to care for up to 100 patients. The patients who will be coming here will be low acuity COVID positive patients, meaning these are patients who need neither a ventilator or an ICU bed. However, if a patient is here and their condition worsens, there are 6 rapid treatment spaces where patients can be stabilized and returned to an acute care hospital. While building the site was the work of many local and federal partners, operating the facility will be done through a partnership between DC government, the United Medical Center, and MedStar Health. Patients who come here will be treated by MedStar doctors, nurses, and staff. And the site, of course, is fully stocked with the necessary medical equipment to treat and care for patients. You can see more of the features. I know that we're going to provide a tour, and we will talk through. I'll have the medical professionals talk through what you'll find here. So I just want to finish by thanking so many people who have been involved. Let me start by thanking our federal partners who have been just wonderful to work with in a very short period of time and in a very professional way. Let me start by thanking the United States Army Corps of Engineers. You'll shortly hear from General Semonite. I also want to thank FEMA for their ongoing support of all of the emergency planning and expenses that the district is working through. The U.S. Department of Health and Human Services, the U.S. Public Health Service Commission Corps. I want to thank my team at DC Health, DC Homeland Security, DC Department of Public Works, General Services, Fire and EMS, Transportation, and the DC National Guard. And of course, want to thank our host, an industry that was first hard hit by COVID, and that's our large gathering spaces like the DC Convention Center. And I don't have to tell you, they have planned and pulled off many wonderful events here, and we can't wait for them to come back, and we appreciate the hospitality of the Convention Center today. So let me now turn to Administrator Gaynor to speak on behalf of FEMA.
Good morning, and thank you, Mayor Bowser, Lieutenant General Semonite, and all the distinguished guests joining us here today. This alternate care site would not have been possible without close cooperation of federal, district, and local officials to support the District of Columbia, the U.S. Army Corps of Engineers, the U.S. Department of Health and Human Services, Events DC, and FEMA work together to expand medical surge capacity by 437 hospital beds here at the Walter E. Washington Convention Center. We hope, as the Mayor said, that we won't have to use these beds, but it is our goal to ensure that the district is prepared and ready to provide the necessary care should the need arise. On behalf of FEMA, I want to express our gratitude to our federal and local partners for their support as we work together to improve the safety and security of the American people. I also want to take a moment to thank the medical professionals here in D.C. and across the country that have worked tirelessly to care for patients in the fight against COVID-19. The partnership you see at work here today is just one of the FEMA's continuing efforts in a whole of America response during this pandemic. In total, the Army Corps has awarded contracts to design and build 37 alternate care facilities in the states and territories across the country. This site is tailored to meet the medical surge needs of the district and will relieve strain on the existing medical infrastructure. If needed, FEMA stands ready to support this alternate care site by providing additional assistance. To date, FEMA has obligated $56 million for the Army Corps assessment and construction of a medical surge support facilities in Washington, D.C., both here at the Convention Center and at the United Medical Center, as well as other support. We also have a Battelle decontamination unit operational here in D.C. to support the safety of our medical community for the decontamination of N95 masks. Thank you to Mayor Bowser, to the District City Council and Events DC leadership for facilitating this operation here at the alternate care site. By working together, we can protect and support the citizens of the District of Columbia and provide additional capacity for local health care services during this national emergency. Thank you, Mayor.
And thank you, Administrator. And I also should mention that our lead FEMA person is Mary Ann Tierney, who's been very responsive to everything we need. So thank you for that. Let me turn now to Lieutenant General Semonite. The Lieutenant General just showed me some of the aspects, including a shower that was delivered here in a container, what do you call that? Container truck. So we can see the innovations of the U.S. Army Corps of Engineers here and how they're brought to bear in response to this pandemic. Thank you, Lieutenant General.
Well, Mayor Bowser, first of all, on behalf of all of us in the Army Corps of Engineers, you need to know that we're very, very excited to be on your team, working with Administrator Gaynor. I can't think of a more noble calling to be able to build a facility like this to be able to help keep people alive. This is our 59th day of doing it. Administrator Gaynor said that we've built over 37 facilities, that those house about 15,000 people. And we've also given to states about 36 other designs that they've built for about another 13,000. And Mayor, the key thing about this is that every time we build one of these, every night we call in the lessons learned of where we built in other places of the country. And we have wrapped in all the lessons learned. And I've got to admit, I've been through an awful lot of these facilities, but this one is probably the best one we've ever built because it's the one this is the most current, and we rolled all of those other capabilities in, and I'm going to talk to you a little bit about it. And we're so excited to be FEMA's engineer, and I tell you, we get unbelievable support from FEMA, and the administrator has been unbelievable. So first of all, the duration, it took about 22 days to be able to build this, and that's both the design of this as well as the actual construction, and we got it done on the 8th of May. We're definitely done on schedule. The mayor, talked a little bit about how many beds. There's 437. Those are about 10 by 10 pods, we call them. There are 6 other rapid treatment pods. They're right behind us here. These are about 20 by 20, so if there is a problem with a patient, they bring it in here where the nurses and the doctors have a little bit more room to be able to work on that. We didn't build them out, but there are 3 big halls here. There's also Hall B and Hall C. So the mayor asked us to design that capability, and if in fact we ever needed it, God forbid, we'd have the capability already designed to be able to put those in there. And when you think about the pressure, and I'm going to keep this very, very simple, this whole facility is built with 2 types of pressure. Negative pressure is what we basically do. We call it the dirty side. So where does the dirty linens go? Where does the other capability? So that's negative pressure to keep the dirty air inside. And then we have positive. When you have clean clothes or food coming in or staff coming in, how do we make sure they're in positive areas? All these big silver ducts that are above us, all the wiring, that's all to be able to make sure we're taking care of those 2 different pressures. Extra capability, it was on a slide, but I'll just say you real quick. Pharmacy, a big backup generator to be able to make sure that convention center never goes down. A oxygen production plant. You'll see copper wires or copper lines running around. That's to be able to bring oxygen in from a plant we built up on the 3rd floor. There's rooms to be able to store the x-ray equipment, 5 big nurses stations, but we also built 11 augmentation nurses stations if they needed those. What's inside a patient's room? You basically have a nurse call, you have a place for a laptop, all the IT connections. There's a code blue button. The nurse just pushes 1 button and it goes right into the nurse's station. You've got oxygen in about half the pods, lights, and even a temporary toilet. And then when you think about some of the interesting facts here from an engineering perspective, 37 miles basically of electricity, 17 miles of IT connection, and you've got about a half a mile of these oxygen pipes that are all running through. And I would just tell you, ma'am, that we could not have done this without the entire team. Your team has been phenomenal from the DC lane. We've also had great support from FEMA, but our Corps of Engineer team, the Baltimore district's the one that built these, John Litz and his team, and then 3 outstanding contractors. The overall prime was Hensel Phelps, but great support from NC Dean, who's our electrical, and also Southland Industries, which is our mechanical. And again, we build it all over the world, but I can't think of a more viable thing for the Corps of Engineers is to do to step up to give you, like you said, an insurance policy so that if needed, this capability will keep people alive. Thanks for having us here, ma'am.
Thank you so much, Lieutenant General. I now want to turn to Jack Sava from MedStar Washington.
Thank you, Mayor Bowser. When this pandemic began, we at MedStar Health knew that as the largest healthcare system in the capital region, we would have a major role to play. And we've taken great pride in caring for the district residents and patients from communities all across our regions. And when the time came to extend surge planning beyond the walls of the district's hospital, it just made sense that we would step up to that challenge as well. What you see here today is a result of an incredible and frankly inspiring effort by many people and many teams. The physical structures themselves are a collaboration between the Mayor's Office and the Department of Health and FEMA and the Army Corps of Engineers and numerous other agencies and entities. And my colleagues and I have felt the same way that I'm sure you all feel when we first came in here and saw an expansive, glistening, white new hospital where just a few weeks ago there was nothing but empty space. The care system that's been created here represents the efforts of too many people to name, but I want to highlight just a few. John Rockwood is the president of the MedStar National Rehabilitation Network, and he has overseen the critical logistics of this project since its inception. Dr. Chris Gallagher from MedStar Washington Hospital Center brought not only clinical expertise, but also military experience in standing up field hospitals. Dr. Al Roberts, who can't be here because he's back at the hospital caring for patients, is the head of pulmonary critical care at MedStar Georgetown, and he has seen not only the very worst ravages of this disease, but he also served 5 years on the USNS Comfort. Really, though, the two engines that are driving this project clinically are the two nursing leads. Carol Edwards is MedStar's Chief Nursing Officer for Ambulatory Services, and she has spent every moment of the last couple weeks thinking about the needs of patients here, specifically the needs that are unique to this care setting, which is somewhat different from a typical hospital. Donna Walters is a nurse and a patient safety expert, and so she's been singularly focused on bringing the same commitment to patient safety to this site as we do to our hospitals, urgent care centers, and ambulatory centers. It's really been an inspiring journey for all of us, and we're grateful to have been a part of it. It's brought together the best of teamwork in all of us, and it's showed how deeply all of us in the room here care about the patients we serve. Like everyone, we hope not to ever use this place, but we're proud to be here with our district and federal partners for whatever this disease brings. Thank you.
Thank you so much, Doctor. Greg Odell from Events DC.
Thank you, Mayor, and good morning, everyone. On behalf of our Board of Directors and our staff, we're honored to support the Mayor and her leadership, unfortunately, obviously, in these unprecedented times, but in this critical public health response. I also want to take time to thank Administrator Gaynor as well as General Semonite for their leadership and partnership for what has truly been an amazing build-out of this facility. In the convention center, by its purpose, it's pretty adaptable use, as you can imagine, and we see many, many things on an annual basis. But obviously, we've not seen the building transform like this. Quite humbling to see, but we recognize the criticality and the purpose for that. And so we want to thank, again, the Mayor. We want to thank all the frontline workers, and we'll be here for as long as we need to support this effort. But we're grateful, and we'll continue to serve. So thank you, Mayor.
Thank you very much. So with that, I think that we will entertain your questions. Questions? Questions, Sam?
That the FEMA administrator said that you spent, I guess, $50-some million on this center, and you said United Medical Center. What's going on over there?
Administrator, if I could turn to Director Geldhard, who is leading our operations efforts through our HCMA ELC, who has worked very hard with our team on this facility and the other surge beds. So Chris, if you could talk not just about those expenditures, but how we're getting to our surge capacity.
Yes, ma'am. To answer the question, at UMC, we've actually worked with both the Corps of Engineers, our National Guard, and FEMA to bring in 6 pods, which is a pilot project for them, that can house patients out external to the hospital, where we can have additional care that we wouldn't have the space for necessarily in the hospital. Those pods are connected to the hospital. They are staffed by folks from UMC, and they're there to add additional space, so UMC has additional space to care for patients during this COVID event.
That's staffed by UMC people, and this is staffed by MedStar only, or is it a combination of the two? Or?
So the pods at UMC are staffed by UMC, and they're overseen by their clinical staff. This facility here, MedStar is our partner for the clinical side, so all clinical oversight of things that happen here will come through MedStar.
People can be served over at that site.
So we added 6 pods to the existing capacity and surge capacity that was built at UMC.
I'm just saying the pods control, to help how many people? What? Here they.
So each pod
Can we go to the surge capacity?
Yeah.
And Sam, if you could refer to page 6 in the notes that you have, you will notice the number of surge beds delivered for each facility, including the United Medical Center.
So the United Medical Center was able to add 80 additional surge beds. The 6 is included within the 80. So 74 without, 80 total.
Yes.
Mayor, this morning in the Washington Post, a man named Jack Wells wrote a letter to the editor, and he makes a claim, and I'm just going to read it verbatim. He says, on April 28th, the mayor announced that the district would test asymptomatic people for the first time, but only if they could identify a particular person who had tested positive with whom they'd been in contact. For the week following that announcement, the district averaged 850 tests per day. That's 23% of the claimed testing capacity of 3,700. He doesn't believe that this testing capacity is where it should be, and then he follows that and says, at this rate, we'll never do enough testing to safely reopen the city. Your reaction to that?
I'm happy to read it for myself and provide a response. Any other questions? Yes.
President Trump continues just a few blocks.
Can we get some sound for this question? Is that possible? I'm sorry, I can't hear. No, yes, that would be great.
Just a few blocks away from here, President Trump continues to say that it's reopening. How does that make your job easier or more difficult when you have the seat of the federal government in this district offering conflicting messaging about the reopening of this country?
Well, we've been very focused on our jurisdiction. I'm not sure what outlet you're from.
Vice News.
From Vice News. And we have discussed almost in a daily conference what it will take for the district to be able to safely begin a phased reopening. We are very focused on several metrics that have been widely discussed, how we see for a sustained period of time decreases in our cases, how we know that our hospitals can accommodate a surge or even a second surge, in operating at a normal capacity. Also making sure that we can test and trace newly infected people. So we are working towards all of those things. The residents of the District of Columbia, our businesses, have put us in the position that we're in right now. Fewer cases by many thousands than we thought we might be, but we still see new cases. We still have community transmission, not only in Washington, D.C., but in this entire region and the jurisdictions that surround us. So that is why we have been very focused on a phased opening that will keep us safe, as well as making sure that our testing capacity and tracing capacity is going to wind up in line with any reopening. Yes.
Help cure coronavirus?
I'll turn to Dr. Ness, but the question was about, I'm not going to pronounce it correctly, remdesivir, and where that is in the district.
So I think I appreciate the spirit of your question. So over the weekend, there was an announcement that the federal government was making plans to distribute remdesivir to all of the states. We will receive a supply of that, and we'll make allocation plans to all of our hospitals based on their current treatment of COVID-19 positive patients. We will plan to allow our hospitals to accept the allocation. We are not planning to force the allocation on any particular hospital.
Do you know how many doses the district will be getting?
Our initial allocation is expected to be 400 vials. We are still continuing to await information as it relates to ongoing or long-term distribution plans from the federal government.
Yes.
So what has to happen? What's the trigger for activating this facility and having patients come here? Does the capacity number have to get to a certain number, or is it based on an individual hospital? What actually do we have to look for before we would see that this would go active?
Let me turn to Director Geldart.
Sure. So the question is, what trigger would need to be in place for this facility to be used? We have a lot of capacity that has been built by our hospitals, inside their hospitals. The best place for a patient to get seen and get care is inside the four walls of the hospital. So we are going to ensure that we use the maximum we can of hospital space, and then we would look at how we bring patients into here. And that process will go from the individual hospitals first to here. So we want the hospitals to use their surge capacity because that's the best place for a patient, and as we get close to that capacity, that's when we would start to accept patients here.
So if we could just turn to we're on slide 5, and you can see above the red line there, which is the total number of people in our hospitals, both COVID and non-COVID. Above that is a light gray line. And in that light gray line is the total number of beds in all of our hospitals during normal operations. The next gray line represents the surge beds within the hospital's four walls, which puts us at 3491. Above that is another gray line, which represents all of the surge beds, including this alternate care facility. So you can see as we would approach the hospital surge line within the four walls is when Chris and his team with Dr. Nesbitt and all of the hospital providers, we have assigned a liaison, and Chris, if you want to talk about the liaison at each site, which is helping from everything from helping us know where they are on where they have been over the past weeks on their construction timelines, to staffing needs, and to also letting us know on a daily basis where they are with their ICU beds and their ventilator use, so that we can report that information daily. That liaison is going to be a critical link to us. Chris.
Thank you, Mayor. As the mayor is talking about, our Department of Health, who are the folks that have been working with the hospitals throughout this, has increased its capacity in working with the hospitals to put liaison officers, both from a health perspective and from actually we're leveraging our National Guard to provide additional resources out at the hospitals to work with them to understand where are they and what are the needs that they have. And the hope in that is to address any needs they have inside the hospitals so that we can continue to treat patients there. As we reach capacity, as the mayor said, and you can see on the slide here, they will work with our coordination center here to understand when we start to get to capacities inside the hospitals, and then we would take patients from the hospitals as they came into the emergency room or into the emergency departments and then move them to the facility here. That's a close relationship between the Department of Health, the team that's working on the surge, and the hospitals.
Yes, I'm sorry, I don't know your name, and I see half your face.
Sally Ihan,
Hi.
I'm TRT World. Thank you.
Okay.
Thank you, Mayor. Given that Turkey donated some PPE equipment a couple of weeks ago, will that equipment be stocked and utilised here at the facility?
So we have several warehouses in the city that's supplying the response to COVID throughout the city. Some of those are warehouses housing personal protective equipment that we bring in as we get it, whatever source we get it from, and then source to those hospitals, nursing care facilities, and others as needed for testing and things like that. So all of the equipment that we get in, we push out to the most useful places at the time that need them, to include this facility.
You don't know specifically, though, if it's the PPE equipment from Turkey or not?
No, it goes into our general supply that we have, that we're maintaining a good understanding of burn rates throughout all of our operations to make sure we're keeping them stocked.
This could be either for the mayor or for Dr. Nesbitt. Last week, I think it was on Friday, the call with the council, Dr. Nesbitt, I think you mentioned to the council members that the expectation is that late May is going to be roughly peak for, I guess, kind of hospitalizations, potential deaths. Is that still the assumption? Is that what the projection tells you, that the next couple of weeks are going to get a little more intense, and this is why and maybe facilities like this could be in use over that time period?
Yes, that is still the estimated time frame for our peak in this region.
I have a question, Mayor Bowser, for Dr. Rodriguez. Of course, we're in this COVID period, but we're also starting the hurricane season. And God forbid a hurricane comes to this area, but can the District of Columbia handle what's going on with COVID and a potential hurricane?
Well, thanks for that good news question.
Thank you for the question. We at the Homeland Security and Emergency Management Agency have begun our hurricane planning. Actually, we were, the mayor mentioned, and Administrator Gaynor's team has we've already been working with them and our FEMA Region 3 to begin our planning and exercises for hurricane season. So we can walk and chew gum at the same time, and we will be prepared for the hurricane season.
Thank you, James, for that question, and a good question, and I'm sure on the minds of many people, so thank you for that. Yes, sir.
How long is this facility currently expected to stay up and running, and what are the operational costs like? And can you walk us through how the city is going to decide whether to shut this facility down?
And this is not a flip answer, but we're going to use it as long as we need it, and we don't know the answer to that yet. So that's kind of the high-level answer. And what was the other part of your question?
What does it cost to just keep it running, even if you don't have patients here?
Sure. Let me turn to Chris Geltart to talk about how we're operating.
Sure. The operating costs here, we work through Events DC to ensure that as long as we're staffed, the vendors and the folks that would work at the convention center here are the ones that would continue to do that. So we will continue to work with Events DC in maintaining the operation. We just got stood up this last week, so the long monthly costs and things like that were not, we don't have a full estimate on those yet, but they're the same costs that would be going on to keep the lights on in the hallway here and the air running, and that's basically all we have for now until we see patient one, and then that algorithm changes at that point.
Are nursing homes in DC required to accept patients with COVID-19? We believe they are in Maryland.
Dr. Nesbitt?
The admission practices of nursing homes have not changed. Nursing homes are not allowed to decline admission to a patient because of their COVID-19 status.
An update on rapid testing and where that's being deployed in the city?
Dr. Smith?
We are deploying the point of care instruments now. We're in the process of deploying those, and we have specific facilities that they've been provided to. They fall into the category of long-term care facilities. We have a pilot project with one of the long-term care facilities. We also have deployed them to the jail, working with Unity there. We have deployed to one of the shelters here in the city, working with Unity at that facility. We are deploying one to DYRS. At this point, we have also deployed two to St. Elizabeth's, and we have provided one to Mary Center. The point of care instruments are also being used on our mobile capacity and capability. So as we move throughout the city, we are using those point of care instruments there. When we are finished with that and no longer need to do that, we will be deploying the rest of those probably to support additional testing throughout our long-term care facilities or our homeless shelters.
Go to the phone. You asked.
I have a question for either Dr. Smith or Dr. Nesbitt. What is the current daily capacity for testing in the city, and how many on average tests are you conducting?
So for the entire city, when we talk about daily capacity, it's over 3,700 tests could be conducted by all the different laboratories that could participate in testing. I will say we had our highest day on Saturday. We tested over 289 samples. on Saturday. Our capacity runs between 300 and 500 tests per day, depending on the systems we're using. And I just want to point out in a recent, or on one of the databases that are out there, I believe it's called Worldometer, we are 7th. If you put all the states together in the District of Columbia, we are ranked 7th as the number of tests that we are doing per 100,000 people. So there is a lot of testing going on in the District of Columbia at this point in time. And remember, I think the other thing about testing should not be done in a vacuum. All the test results we are given are being given with some diagnosis, some decision being made with that testing.
Amanda Gomez.
Amanda Gomez from City Paper. Amanda Gomez, you're unmuted.
Tom Sherwood.
Well, thank you, Mayor. There's been a virus outbreak at the White House. What role is the district playing in any response to it? And are you at least actively monitoring it since people come and go inside the city to get to the White House?
Well, we certainly, I'm going to ask Dr. Nesbitt if the physicians at the White House, I think they're doing their own testing, and so those tests would not come to our public health lab. And certainly if they did, that would give us the opportunity for DC Health to assist with the contact tracing, and we would be available to provide that assistance. Similarly, Dr. Nesbitt and I have also offered to the Congress to make sure that our health lab would be available for any tests or samples that are taken at the Congress, and we make the offer to always keep them up to date with the information that we have on the ground. Dr. Nesbitt, is there anything to add?
No, Madam Mayor, the only thing that I would make sure people understand is that while we're in this phase of widespread community transmission and our activities focus on mitigation, we do not conduct contact tracing for every case that occurs in the district. As we are ramping up our contact tracing efforts, we would then do contact tracing for every case that is diagnosed. Our contact tracing efforts have focused on those cases that occur in congregate settings. So while these cases have been made public and are very high profile, most businesses and places of employment are conducting their own contact investigations and notifying their own employees, and nothing different should be expected in terms of how the physicians and healthcare providers who care for the individuals at the White House and the Office of the Attending Physician who takes care of the members of Congress and their staff would deal with it accordingly.
Amanda Gomez.
Hi, thank you so much. Can you hear me?
Yes.
Okay. I have 3 questions today. My first, can you, just to confirm, every acute hospital in DC has surge beds in place. They're able to handle a surge in patients. Is that right?
Let's go to the slide that shows on page 6. And you can see the hospitals and the surge beds at those confirmed at those hospitals.
Thank you.
Mm-hmm.
And my second question is, has there been a targeted campaign focused on the Latinx community to practice social distancing and to get tested, seeing as they're seeing the most positive cases? And if yes, can you just describe some of that?
Certainly, I think you know from early on, we have conducted outreach in English and Spanish and been very focused on testing, and we continue to do that. We're also very focused on the message about isolating if one is positive and how to get additional resources if you are in quarantine or isolation. Yes, Finnett.
I wanted to clarify the earlier answers about contact tracing for the White House. I thought the mayor said the city's offered up contact tracing, but then from Dr. Nesbitt's answer, it sounded
I
like...
actually didn't say that I offered anything. I said that if we were contacted for assistance or if our public health lab was involved, then they would engage with the Department of Health. That's what I said.
Okay, so the city is not offering to do any sort of contact tracing for the White House?
We aren't doing any testing for the White House, and so our public health lab is not engaged.
And then to clarify another answer from Dr. Smith, when he said this Saturday saw the most number of tests conducted, that was at the public lab and that was 289?
Yes, that's correct.
Why have we consistently seen the public health lab come below the capacities we've been told?
Well, again, I think if you see, we've seen an increase in the number of samples that are submitted. So we test all the samples that are provided to us and are submitted. And this is a community effort. So there's a lot of testing going on in other facilities, other hospitals, other doctors' offices. So it's a community effort, and I think that's important. But certainly we are seeing an increase in submissions coming to the public health lab, and we are providing results for those.
Mayor Bowser, when do you expect to make a decision about increasing the shelter-in-place order or continuing the shelter-in-place order? I believe it expires on Friday, on the 15th. And also, I know if you continue the shelter-in-place order here in the district, I believe Virginia and some of the surrounding states are going to start slowly reopening outdoor restaurants and seating and stuff like that. How do you plan to keep DC safe if something like Virginia and Maryland start to slowly reopen?
Well, we know that there is community transmission of this virus, not only in Washington, D.C., but in all of the areas that surround us. So we would be very, very concerned about turning on activity too fast. In any setting. And so we are very focused on DC residents continuing to social distance, to only go out for essential activities, regardless of the jurisdiction. And we want to make that point very clear. As you can see, we have not seen a steady decrease in the number of cases in the district. And even though our hospitals are prepared for the surge that we will have this month, and also would be prepared as economies start to open up for new cases that evolve.
Make a decision about the shelter-in-place order being extended.
We'll do it this week.
It might last.
I don't know. Next question.
Just following up on what Finnett was asking for Dr. Smith. So when you say 289 samples is what you guys tested, does that mean that only 289 people were tested at Bertie Backus and UMC, or what are we missing here? Because those are big sites that were rolled out to provide relatively widespread testing of the population, but if you're only talking 289 samples, that's not a huge number of people.
The daily sampling that we're doing, we get samples from all of the drive-thrus. We also get samples just submitted directly to the laboratory. The majority of the samples that we see are coming from the drive-thru events. Those drive-thru events do not happen on the weekend. They're mainly Monday through Friday. So that's what you will see. You'll see an ebb and flow. Those results also include if we've sent out the mobile testing capability. So again, the numbers are going to fluctuate from day to day, but that 289 has been our highest day so far.
A couple of questions. One, what do you say, and this may be for Army Corps or whoever, what do you say to residents? Remember when you opened up the quarantine hotels, there was some concern from neighbors of those facilities about having a facility like that in their neighborhood. What do you say to neighbors in this neighborhood who may be concerned that there will be an influx of COVID-19 patients coming into this facility, and how safe does that
I got to tell you, I haven't heard a lot of that. I just haven't. And I think that people are right to ask questions to make sure their operations are, that we've thought of everything, we've dotted I's, crossed T's, and that there is a process if there is something in the operation that is not up to snuff. But I haven't heard anybody say they don't want their fellow Washingtonians to have a hospital bed. I just haven't heard that.
I didn't mean to imply that anybody had said they don't want their fellow Washingtonians to not have a hospital bed, but people have expressed concerns about what this means for their safety protocol in their neighborhood, or if it's nothing they have.
I just haven't heard that.
Okay, well, will you humor me? Perhaps if you go onto Twitter, people are expressing that concern. I know you haven't had a chance to check Twitter in the past 10 minutes, but people are. So should neighbors be concerned?
No, neighbors should not be concerned. Yes, Sam.
I've heard you several times talk about the difference between what you expected and what exists now. So right now we've got about 6,400 cases and 300 and some deaths. What were you expecting at this time? Maybe Dr. Nesbitt.
I'll just refer you to our very first presentation on modeling for the district when we met at the DC Armory. And that was weeks ago. I'm just wondering. I'm happy to provide it to you. This is the up-to-date number that we just reported on.
Right, I understand that, but you said you projected it. It's lower than what you expected.
I don't have that model right in front of me, Sam, so I can get back to you with that. The day that what we would have expected from the first model.
I do appreciate that. And then the other thing I was curious about, you have said that that when they open, that basically once these other areas open up, you're concerned, I guess, about a possible impact here. So are you thinking that what we have now is going to get worse? Is that what you're thinking at this point? Once, say, the neighboring jurisdictions or even DC itself opens up to some degree?
Well, all of the models that are now reflecting reopening nationwide show increases in cases. So it stands to reason that when now people have been social distancing, when they start mixing, that you'll have more infections. We don't have a cure, we don't have a vaccine, so when we know that there will be more infections.
One more question for Dr. Smith. According to the coronavirus.dc.gov site, it says that approximately 30,000 tests have been done in the city. Does that include only the public testing sites, or is that's testing that's been done at hospitals and public and other facilities? Does that include every test that's been done in the city?
Sorry. So all the testing that has been done is accumulation of different partners involved in that. That could be private laboratories. Those could be hospitals. Remember, DC Health requires that if you do a test, positive or negative, you are to report that to DC Health. So if everybody is doing that, then that is the cumulative number of all the tests and individuals tested for DC.
Okay, last questions? Yes, Mark.
Pediatric cases that we're hearing about, I guess first out of New York, and now we understand there are some at Children's Hospital. What can you tell us at all about these new cases and how it's impacting Washington, D.C., and particularly the hospital capacity at Children's?
There's still a lot that we are learning in terms of the impact of COVID-19 on children. We've reported to you all, especially last week, a focus on our interest in learning more about children. And our observations so far have been consistent with observations across the country in terms of more severe illness on the extremes of age groups in children 0 to 4 and 15 to 19. As you all know, we have also reported in terms of the capacity at Children's National that we were initially in terms of, and if you go back to the medical surge chart, they have expanded some of their capacity there. I also signed some certificate of need declarations in terms of expanding some capacity at the Hospital for Sick Children, which is part of the Children's Network. So we have confidence in the medical surge capacity at Children's National, including having given them an exemption very on for them to serve individuals up to the age of 29. Last week, we sent out a health alert network to ensure that we are capturing any of these cases of multi-system failure or impact where children who have this atypical presentation of COVID-19 are required to be reported to the district. Is similar to the health alert notice that we sent out back in December when we were seeing pneumonias of atypical etiology before SARS-CoV-2 or COVID-19 even had a name. So it's part of our way of trying to capture enough data to make sure none of these cases are going missed in the district as it relates to this pediatric syndrome. Currently, a lot of the pediatric hospital providers across the nation are working with the CDC to make sure that we have the best description of this pediatric syndrome, and as that information comes out, we'll make sure that we update our health alert notice. At this time, we do not anticipate that the number of children to be impacted with this atypical presentation will compromise our medical surge efforts. There has been one case in a district resident.
More children that aren't district residents. So are you only getting information from your children on those that are district residents and not patients that?
So to continue to clarify, hospitals are only required to report to us, and healthcare providers are only required to report to us cases that occur in district residents. However, we have visibility on all admissions in hospitals in the district, regardless of residency. So when we're talking about a hospital's capacity to admit patients who have any diagnosis, you've seen that information today. When we talk about 71% of our hospital's capacity, whether it's COVID-related or non-COVID related, that's for people regardless of where they live. If they're a DC resident, Maryland resident, California resident, receiving care in our system. So that gives me the ability to say that we have the capacity in our system, including in our children's hospital, to be able to take care of individuals whether they have COVID or non-COVID diagnoses. As it relates to any children who are receiving care at Children's with this particular diagnosis, they are only required to report cases to us that occur in district residents.
I appreciate you going through that. So the number on the chart of COVID patients that are being reported by hospitals, is that also all COVID patients, like the total patients is, or is that just DC residents?
That chart is all patients regardless of residency.
Thank you.
Yes, sir.
To chart 5.
Yeah.
Okay. Page 5. Okay. Thank you, everybody. Thank you.